You know, we talk a lot about heart health here on Sonoran Living. It's because we want you to be proactive when it comes to being healthy. So I'm at Mayo Clinic with Dr. Francois Marcotte, who's a cardiologist here, and we're talking about congenital heart disease. I've heard about it, Dr. Marcotte, but I don't know exactly what it is. What is it?
Adult congenital heart disease is an adult born with a heart defect. Birth defects occurring in the heart occur in about 1% to 2% of all births. And in adults, the prevalence or the frequency is roughly about 0.5% of all adults, which means that roughly about 1 million Americans living in the US have this kind of disease.
And they don't know it?
Many of them will know because they've been identified as babies, either because they were blue babies or had significant symptoms and underwent surgery as youth.
Oh, okay.
But sometimes we identify these in adults who have unsuspected this problem was present before.
What's happening to the heart if you have congenital heart disease?
The thing about congenital heart disease is that there's a very, very wide spectrum of abnormalities that range from defects in the wall between the two sides of the heart, called septal defects, to blockages in great vessels, like what we call coarctation, to entire parts of the heart that are missing, that we call atresia. There are hundreds of diagnoses and thousands of possible permutation and combinations. So there's no one quick fix or diagnosis for these. What we know is that these individuals usually will have had, fortunately, repair in childhood. Symptoms that are worrisome for us that need adults to call to action, to use your words, are if you feel breathless, if you have palpitations, your heart's racing at 150 beats per minute, or you lose consciousness. That can sometimes be a sign of heart disease, congenital or other.
Okay.
Such symptoms often lead to tests being done, like investigation, like ultrasound, MRI, chest X-ray, EKG, and these can reveal congenital heart disease in the various form I've described to you earlier.
Well, and it sounds very scary, and of course anybody sitting at home listening to this, may have experienced some of those symptoms and have done nothing about it. First of all, we're saying take action, do something about it. Explain to us, though, what could be some of the treatment options, understanding that everybody's different?
Well, first, you have to seek attention from a healthcare professional, so your primary care physician, and if necessary from a cardiologist once your primary care physician is worried about heart disease.
Okay.
The heart specialist will look at your story, look at your physical findings, listen to your heart, and if he or she hears a murmur or finds abnormal blood pressure measurements or other physical findings, will order tests to basically uncover this problem. Some defects, fortunately, do not require any treatment. They just create a very loud murmur without causing any major stress on the heart. And those we simply do watchful waiting.
Okay.
Others will give symptoms, and for that, well, we got to help people. So if you have palpitations and you're getting what we call arrhythmia, your heart racing at 150 to 200 beats per minute, we have to do something about it.
Okay, so a lot of options, which is the good news, but most importantly, you're sitting here watching this segment and thinking, you know what? How can I prevent it? Eat right, exercise.
Don't smoke.
Don't smoke. Don't smoke.
Drink responsibly.
Drink responsibly. And you know what? Most importantly, any of those symptoms, if you're experiencing those, see a cardiologist. Dr. Marcotte, thank you so much. Good information. And here's more information for you. Well, it is time to take action for your health, and to learn more about the cardiology division, visit mayoclinic.org/Arizona to learn more.